I love learning, and when I say learning, I don't just stop there. I make sure I do a research of what I want to learn, how do I want it to come out, and this helps both me and my audience. And on today's show, I've just decided to visit an hospital. Once again, welcome to UBC. My name is Susan Awar, and you're on The Life I Live. In case it's your first time joining this show, we feature persons with disability and people with the chronic diseases. And that's why today I'm in an hospital trying to learn about eyes. And yes, I have a young, beautiful lady with me who is going to take me through what they do. Maybe you need this than I do. You're welcome. Hi.
Hi.
Good afternoon.
Good afternoon to you.
How are you? You're going to briefly say hello to our viewers, then you're going to tell them your names and what you do and where we are right here.
Okay. Good afternoon to you all. I am happy to be at UBC. This is Kampala Eye and LASIK Center. It is an eye hospital. It is located at Acacia Mall on the 3rd floor. So generally we basically work on any eye problem, and I must say we are the best eye hospital in the whole world, I should say. So generally if you have any eye problem, we do the normal checkups and all types of surgeries. There are people who have cloudy vision and they do not know that is a problem. Probably it could be a cataract and you do not know. So if you come here at our hospital, we have Egyptian doctors, then we have the retinal specialist, Dr. Ludo, who usually comes in. So if you come in, we do an eye checkup, we find out what eye problem you have, and we give you a solution.
Okay, we have a young lady called Fiona, and this is Kampala Eye. Just in case you missed, we are here learning about eye problems. What does it take to get yourself treated? When should I know I have an eye problem? Maybe you're going to take us through the procedures. So how do I know I need to go to an hospital to have my eye checked?
Okay, you do not have to have a problem for you to come to an eye hospital. You can just do a normal eye checkup. There are people who just walk in, they want a normal checkup, and they have a problem called glaucoma. I do not know if you have had a problem called glaucoma, but it makes your vision blurred. First of all, I think it doesn't have any symptoms. But slowly by slowly, you find like you cannot be able to see this other side of your vision. You only see this side. So by the time you know that you are not seeing other edges, the glaucoma has already eaten up almost all the nerves. So you need to just do an eye checkup. Then there are people who have red eyes. Maybe they have itchiness. So you just have to do an eye checkup. But here we deal with cataracts. That is, people know it as a blurry vision or a cloudy vision. Then we also do keratoconus. I don't know if you've heard about keratoconus. It is an eye disease that when you continue rubbing your eyes, the shape of your cornea changes. So that makes you vision very poor. And the only solution to that is a procedure called cross-linking. So we do cross-linking, keratoconus, that is the keratoconus surgery, the cataracts, and LASIK. LASIK is a procedure that helps you regain your full sight, and you do not have to wear glasses ever again.
I think I picked interest in the LASIK part because it's what is much about you.
Yes.
So you're going to take us through. Can any other person do LASIK, or I have to have an eye problem if I do LASIK?
LASIK is for people who are long-sighted and short-sighted, and if you have astigmatism as well. So if you're this person who doesn't want to wear glasses, because I know there are people who have eye problems but they do not want to wear glasses. So when you come to us, we first do a checkup on you and find out if you're a candidate for LASIK, because it's not for everyone. If your cornea is thick enough, that's when we do it. If it is thin, then the doctor will be able to advise you according on what you're going to do. So LASIK, we are the only people who do it in Uganda. And I think it is worth doing because, you know, when you put on glasses, every after like 6 months or maybe after a year, you change the lens prescription. But with the LASIK, once you do it, it is once and for all, and you will never have to wear eyeglasses. So I think it is worth trying.
Okay, Fiona, make someone seeing us understand this. Is this LASIK for free?
No, it is not for free. It comes at a charge, which I cannot say right now. It is until when you come to our eye hospital, that's when we can tell you all the details about the LASIK procedure.
Does it have any side effect, or it's just a fine wine? When I do it, I'm gone and I'm fine, I'm okay?
You are perfectly fine. Your full sight comes back, but you only have a bit of dry eyes, maybe let's say for the first week or the first week or the second week. But we give you eye drops that are going to help you not to feel that irritation. Because when you feel a bit of those dry eyes, you feel like there is a stone that has entered into your eye. So we give you the eye drops that will make you relieved. So I should say it is 100% right.
100%. Okay, just in case you've just joined your new BC, my name is Susan and she's Fiona. Right here we are at Kampala Eye and LASIK Center, where they do eye surgeries. And in case you are a candidate, you don't have to wait to be sick, like she said. Come get your eye checked. You don't have to be like you're sick or someone tells you there's an eye problem. Then that's when you rush to a hospital, because you never know, it might be late by the time you come here. Okay, Fiona, you're going to take us through those 3 core services you guys do apart from LASIK. What else do you guys do?
We do glasses for people who are not candidates for LASIK. So we give you glasses. Then we do surgeries. We do, like I said, we do cataract surgeries, we do glaucoma surgeries, we do PPV, that is, those are retinal surgeries. So anything with an eye problem, we are the solution.
Okay, I think you've heard from Fiona herself, and from me, I would advise anyone, if before you wait for your eye to go blind,
Yes.
I'm going to make sure I leave this hospital when my eye is checked. So feel the same.
Yes.
Let's avoid going blind, and at the end of the day, I wanted to know the symptom or the sign or the effect, or how do I know I have glaucoma?
We call it a thief. It steals away your vision without you knowing. You will not feel any you will not feel any itchiness, you will not feel any redness, you will not feel anything. But by the time you feel like your vision is not clear, it is 80% of your vision has gone, and this is a problem that has no solution at all. The only thing we'll do is control your eye pressure and keep it low, because the more the eye pressure goes up, it keeps damaging the veins and the retina. So it has no signs and symptoms. I should say it is very important, because and it can be inherited. If someone has an eye problem, one of their children or maybe 2 of their children will have problems, and when they give birth, one of their children will still have an eye problem. So I think most of us, we don't know how our parents, if they had any eye problem. So it is better when you go to an eye hospital and do a detailed eye investigation. They check the cornea, they check the iris, they check the lens, they check the nerves. That's the only way you can survive from this eye problem called glaucoma.
If you're working in different societies and sectors, we all face challenges. I want to know that one major challenge you guys face here, that you sit back with your team and say, this one was much of it.
The problems we face as an eye hospital is denial by patients. You tell them they have a problem and they say, no, I don't have a problem. And they fear surgeries. That is the truth. Even you right now, if I told you need surgery, you will...
I would faint.
Yes. So people fear surgeries, yet you find it is the only solution to regain their sight. Like cataracts, they have to, when you explain to them that with a cataract you have to remove their natural lens and put in an artificial one, they're like, I cannot be with an
That is too much
lens.
now. It becomes too much for them.
Yes, so they go home and stay there, and this cataract is growing, and this glaucoma is developing every now and then. By the time they come back to us, it is too late. And you telling a patient that there is nothing I can do for you is really hard, especially for the glaucoma patients. But the cataracts, there are different procedures that we do. The advanced technology, which is called fecal emulsification, and then the traditional one called small incision. So that is, I think, the problem that we usually face, denial of patients.
Okay, you're going to give us a tip that everyone should use, not to wait for it to be too late.
I think if, let's say, your parents, one of your parents, or maybe your grandparents ever became blind out of the blue, that should be a question mark to you. Why did they become blind? Because these things usually come back to us, and we do not know who they will catch. So I think it is better to do an eye checkup. It is very, very important to know how healthy your eyes are. Then we can give you medication. You don't have to wait for a doctor to give you glasses. And I think it is very important for you to go to an ophthalmologist and not opticians. Opticians will just give you glasses, and that is all. But you need a detailed checkup. They need to check everything in your eye. I think that's what people should do. So I would love you to come to our eye hospital. And also, thank you, UBC. Thank you for coming to us.
Okay, at least we have a take home. In case you've just joined, my name is Susan, and we are with Kampala Eye and LASIK. Why Kampala Eye and LASIK? Because we are here to learn more about the eye. We're just not learning the eye, but we need to know what does it take for you to lose your sight. People lose sight every day, but we don't know why, how, and when. For now, I'm out for break, and when I come back, I'm still at Kampala Eye and LASIK. I have a doctor who is going to take us through what does it take to be treated. Hi, doctor.
Hello. Hi.
Good afternoon.
Good afternoon, sir.
You're good. You're going to briefly tell us your names and what you do at Kampala Eye.
My name is Dr. Ihab Abu Ali. I am Fellowship of Royal College of Physician and Surgeon of England. I do here most delicate surgery for eyes, especially new technology of correction of vision by laser.
Okay. When I walked in here, the first thing that welcomed me was LASIK.
Yeah.
Yeah. Maybe you're going to briefly tell us what does it take for someone to do a surgery of LASIK.
LASIK first is briefly is vision correction by laser technique. This is not new in the world. It is maybe more than 30 years now. But in Uganda, we have the only machine for correction this problem. We can correct all problem for error of fraction like short sightening and long sightening and astigmatism. So we can correct this error by 5 minutes with our machine.
Okay, since I'm learning, and I know someone on UBC right here is also learning, what are the procedures for someone to get here? What do you go through? Like, how do you prepare this person to the point that the last thing is LASIK?
Yes, this is a good question. Not all people can correct vision because we have patient selection by delicate examination of the eyes and the cornea, and then go to for scanning for what's called pentacam. Pentacam, what is meaning corneal mapping to check the cornea is good for this procedure or not. And then if examination and investigation is okay, we can go to the technique for correction of vision. Some patient selection, this laser technique can to do for patients below 18 years old, not less than 18 years old. You should more than 18, okay? And also should the error of refraction is within normal range of machine. The short sighting, as example, maybe up to 10 numbers of myopia to correct it.
Okay, you talked about the 18 and below. Does this mean it has decision making or their lenses are too weak?
No, the LASIK is very simple technique. If you see one patient, you can told me I can do this technique because this is computerized techniques. The doctor in the operation is very simple procedure, but the main issue, how the decision is the patient is can go to for this technique or not. The decision is this person can good candidate for the LASIK or not.
Okay, we're going to look at being a doctor now. You know at which conditions is someone supposed to get treated. When do you give up and say now at your point? Because I remember someone once told me when you go to hospital and you're too sick, they say now you can go stay home until your day comes. Your condition is untreatable. Do we have these moments in eye also where we say no, this one is untreatable?
In LASIK, our candidate is not patient because our candidates have glasses. This is not patient. About 20% of people have glasses. So this is not patient. He come here as alternative for when he can't wear these glasses, for cosmetic reason, for some sport, for military reason, and some people can't wear glasses at more. Okay, so this is not patient. He come here as cosmetic. When you go to for any cosmetic, you go to not patient. This is candidate. Okay, this client he need to improve his quality of vision, his quality of life by remove the glasses.
Okay, being the only hospital that does LASIK in the country, you must be facing challenges. I should say numbers come in so much, expectations get less. What is that one challenge as a doctor that you sit there and say, being the only doctor that does this is a challenge to me?
Yes, we have many challenges because the awareness campaign we have this we can do this now. Because people here don't mean what is LASIK. First time to hearing about vision correction. Really, I can remove my glasses. This is a surprise for many patients and many technicians also making glasses for me. But these 5 many techniques for HI, after 10 minutes you can remove your glasses at all, and you can live your life without any complaining on your scalp. And also we can go to your work the next day. There is no problem, we can go to, and no covering for eyes many times.
Okay, Fiona said patients live in denial. When you tell them you have this condition, they feel it is not right. Now, according to you, do you have any patient you've worked on that was on denial and later on came back and you worked on this patient?
Yes, many patients here. We make many patients for LASIK, and some patients now, when you come to have any glasses, we can prescribe for him glasses. He wants to sometime to think, sometime to learn about what is the LASIK, and searching online, what is the LASIK, how can correct, how can it work, it is suitable for me or not, and many questions. So he can return after maybe months, maybe 1 year. Some patient wear glasses for 1 year and come again when he can't read it.
Giving you a small throw on what you're talking about. We are talking about LASIK, which is a correction of vision by laser. It is the only hospital that does that. Please, in case you need more details, you can go online. And in case you feel it's not because you're doing just a campaign, I want to know. I feel if I don't know, then most people out there don't know. That's why I had to decide to bring my whole team here so that we learn about LASIK, we learn about an eye problem. What does it take? When should I treat my eye? So, doctor, you're going to give us a remark on someone out there should be having a take-home from you about an eye.
Any people should come to check up his eyes every 1 to 2 years, because we have here some problems in Uganda. When discovered later, we can't do anything. So the precaution and the regular follow-up of your eyes is the most important. And also we can any people for your program can send his glasses prescription, and we can respond to him, is it suitable for LASIK or not. Okay,
you've just heard from doctor, and from me to you, don't take just things so slightly. Don't wait for the last time when you go blind. It's when you say, I once watched a show that had Kampala Eye and LASIK, and just not LASIK. Please try to know how you stand, because as reading about an eye and this, that says your eye is connected to your brain. So in case you lose your eye, you're closely to lose your brain. That's from me to you. And from me to you, please take health to be your #1 priority in whatever you're doing. You're still on UBC, we're still learning. Learning doesn't stop. You don't just have to learn and stop there. You have to take an action on what you learn. Yes, we are still learning, and we should have reasons why to learn, because if you learn without a reason, you're not going to take it serious. There's that saying that says, when you write down your name and you don't look it down better, you're going to misspell it. So we are here to know, why did Kampala Eye start? And why Uganda of all other places? Hello.
Hello.
Good afternoon.
Good afternoon too.
Oh, you're going to say hello and your names and what you do at Kampala Eye.
Okay, my name Muhammad Khamis. I'm the admin of Kampala Eye and the LASIK Center. Yes. Back to your questions, why Uganda? Actually, you have great country here. You have great country and great people in the way. Uganda, as many countries in Africa, has diseases. And as many all world, it has disease. And when we talk about the eye, we have 3 issues very common, make a lot of problems with the eyes. Okay, first one, it is called the reflection error, and those people call the short sightings, longer sightings, has astigmatism, those people using glasses, and that is the first common in all world disease can make the eyes has problem. The second one, it is called cataract. Or cataract meaning clouding on the normal lens inside the eye. And that's the disease, it is affects the people usually with old age. The third one and the dangerous one, it is called glaucoma. Or glaucoma, it is not disease, it is group of disease affect the eye, it damage the optic nerve. Okay, and that's it is come without symptoms we can catch in our hand. Okay, in our place we use example to create a big awareness, or we try make the problems simple to explain for the people. We ask I can ask you questions. Okay. What's the difference between the stomach and the eye? What's the difference between your stomach and the eye? The stomach, if it has any disease, it is make a lot of sound.
Sound.
Okay, I'm hungry, I'm thirsty, I have issue like that. Okay, but the eye, it is more strong like that. It is like soldier in a wear. She has a lot of disease and never noise, and she always quiet. She has a lot of disease, but you don't know about it. Okay, so it is one time it is come down, not like stomach with the smaller issue, complaining, and they make a lot of noise for you. That's why you should be care about the eye. Okay, all the diseases, many diseases in the eye, it is come without symptoms, and they're not easier to you. You find I have that one, or that's one. Maybe the refraction error, or the people using glasses, they know has problem with the eye. But other like retinopathy, for example, you know, anyone has a diabetic patient, he should be follow up and check his eyes, because the diabetic, it is effect and they make a lot of problem in the eye, and they come without any symptoms. One day you wake up, you find a lot of pressure in your eyes, you find blood inside the eye, you don't see it, but you see black, like that. So that our mission. We try create awareness, and create awareness, and create awareness, because I believe 50% from all problems we can fix it by learning or by awareness. If I have enough knowledge about the basics, I should know that's helping me take action earlier, and of course earlier better than
late.
And again and again, when we learn something and take action about it, it will reduce the symptoms we're feeling, reduce the pain, save our money, because many disease we can, or many eye problems, we can fix it earlier with a pocket money very close,
very little.
Okay, and when you come back, we go to theater, and when we go theater, meaning we go with a
big problem,
a bigger problem, and
big money,
also bigger money, and affect our economy as person, affect my budget as person, like that.
Okay, now we are looking at statistics. You know, Ugandans, we believe in figures. There is that thing that we say, when you want to know that something is huge, like right now Ebola is moving around and people are saying 10 people are dying every day, 20 people are dying every day. How many people in a year do you people register with eye issues?
Actually, that's it is hard for us to say real numbers. To be honest with you, it is hard we get it real numbers, because it is other organizations who, national organizations, he should be
giving statistics
and give us the statistics, and for us we follow up the national organization to get this statistics. But as a general, all the world has the same problems. The good news is Uganda not has, according our observations, and we live from Uganda for more than 5 years now, we not have something unique disease, something not common. No, it is
day to day.
African, all world, it is the same problems we have, and the same advanced. What we bring here, we bring advanced. Latest technology, latest science, what advanced, what latest in how we treat this issue, what eye drops we use, what treatment plan, all that we try, and that our mission to give our people here.
In the start of the show, I said you don't have to wait for your eye to go blind. And you also said you don't have to wait for the problems to pile and the money increases so that you can get your eye checked once in a while. While we are learning, we're not just learning because we have to learn. We are learning to have a better life, a better health. You know, better health is that one that you stay home and you have your 50,000 and it doesn't have to go to hospital, it is yours. So that's why we are here to learn. We are just bringing you closely to the people who have the right information. So, Doctor, you're going to give us a remark.
As a general, a lot of behavior, we have it here, and we think that behavior, it is a smaller issue, but actually it is
a bigger one.
Bigger problems in the eye. for example, rubbing the eye. Rubbing the eye, you think that it is
It's a normal one.
normal and common. I don't know what happened in my eye, and I rubbing that like that, and that is really, it is very bad and dangerous issue. Why? In longer time, our eye is very soft. Okay, I will tell you example, and you can use it in your office or your home. Okay, you bring any scotch, any sponge. It is called what? Any soft issue, any soft issue, and try every day you rub it. Every day you rub it. Within 1 month, you will find the soft. That's support soft.
Is damaged.
The shaping, it is different. It is come different. Okay. If it is not clear, my example, let me repeat it again. Sorry. If you get it a ball, soft ball, like people using for playing, for sorry, for the shading or playing any soft issue, and try every day you
rub
squeeze
it
or rub it. Okay. In long time, less than 1 month. Okay, within 1 month, you will find the shape of the ball. It is completely changed. It is the same issue happening in our eye when we rub it. The shape, it is come a big problem.
Before I sign out, I want to thank you so much. It takes a heart to give in your time to come and educate us about an eye. You've left everything you're supposed to do and give us 30 minutes to tell us more about what it takes to have an eye problem. Thank you so much. And from me to you, thank you for having your time to sit down and listen about the eye LASIK and the other eye problems. Don't just take this show for granted. Sit down, learn something, and put it into work. You might not be the victim, but you have someone in your circle. I keep telling my friends, if I don't need a job, at least a friend in my circle needs a job, the same as an eye. You might not be a patient, but someone in your circle has this problem. And from me to you, I can, you can, we can. Every single Monday, 2:30 p.m. 14:30 p.m. UBC.